Welcome, everyone, and thank you for joining us this afternoon. My name is Meredith Collette, and I'm the Executive Director at the American Heart Association in Oregon and Southwest Washington. The American Heart Association and OHSU have joined forces with the goal to reduce cardiovascular death, heart attack, stroke, and heart failure in our communities. A couple of housekeeping items before we begin. Today's discussion is a webinar format, and even though we can't see you, we want to hear from you. We will have time at the end of the program for audience Q&A, so please put your questions in the chat box. Make sure to choose everyone from the drop-down menu. It is now my pleasure to introduce Anthony Mulholland, the Senior Director for Heart and Vascular Services at OHSU Health, where his tenure at OHSU has spanned 19 years. Welcome, Anthony.
Thank you, Meredith. Welcome, everyone. Good afternoon, and thank you for being with us for our heart failure workshop in collaboration with the American Heart Association. Please let me start by thanking my team at OHSU who are providing the content for today's event. And I also want to thank our friends at the American Heart Association who work tirelessly to improve heart and brain health for everyone. We couldn't do it without you. Let me start by giving you a brief history on the creation of these workshops. OHSU, as Meredith said, and the American Heart Association made a commitment to join together, and that was in 2019, specifically to address heart failure. Through our partnership, we've distributed patient information materials on heart failure, we've developed a heart failure online hub, and we've produced these education sessions, which rotate between reaching those living with heart failure and their loved ones, and sessions tailored to educate healthcare providers. Some of you may have attended some of our previous sessions. We thank you for joining us again. Welcome back. As this group was developing the program for today, we wanted to bring a relevant topic, and today our program is going to focus on how to thrive following a heart failure diagnosis and how to plan a confident path forward. We'll hear from two incredible speakers and hear more from our subject matter experts, where we'll have a panel discussion on best practices and strategies. So again, a great big thank you for joining us today. And now I'd like to introduce our first speaker. Caitlin Van Dusen, MSW, LCSW, and social worker with the Heart Transplant and LVAD program at OHSU. Caitlin graduated from Indiana University with her master's in social work. She then completed her practicum in transplant, and that led to a desire to help those with chronic illnesses. Welcome, Caitlin.
Thank you for that introduction. I'm so happy to be here today. And today I'm going to be talking about coping with heart failure. Next slide. I want to start at the beginning. You just learned of your new diagnosis. This can bring a mixture of emotions hearing this information. Your reaction or experience to hearing this can be different from someone else's. You can experience an increase in anxiety or stress. Some patients may feel an edge or a sense of nervousness, or just an overall increase in their stress levels. For some patients, it can feel like it's hard to shut their minds off. Anxiety is similar to imagining a small snowball, which is that initial anxious thought that starts at the top of a hill, then starts rolling down, gathering more snow or more anxious thoughts, growing bigger. This can quickly feel overwhelming and all-consuming if you don't have tools in place to help. Some people may feel a sense of hopelessness when they first hear of having heart failure. Some of my patients have told me that they were unsure what their future would look like and how they're going to manage this new set of needs. I've heard from some of my patients, they share their confusion about their diagnosis. They may not feel like their physical symptoms match this new heart failure diagnosis. Some people may experience feelings of guilt related to their health and the impacts this may bring for their loved ones. Irritability. I hear this very frequently from my patients. Sometimes they might feel like they're short with family, coworkers, friends, and they aren't really sure why. They might be feeling irritable due to feeling overwhelmed and still processing all this information. And your increased stress levels can decrease your ability in the moment to manage this new set of needs. And this can also be associated with the grief process, which I'll talk about shortly. For some people who have had their symptoms of heart failure for a while, it can be a relief to hear they finally have a diagnosis that is directly correlated to how they feel, and give some people new hope for a path forward now that they have an official diagnosis. I want to talk briefly about the stages of grief. By far, this is one of the most common topics my patients bring up, many not realizing that they are talking about the grief process. And you don't have to be dealing with the loss of someone to experience grief. It's an understandable reaction when you first hear your new diagnosis, and it's likely something that's going to come up again in the future as you continue to adjust. So these stages were initially described by psychiatrist Elizabeth Kubler-Ross, and there's a picture on the right side of the screen that has these there. The first stage is denial. This can look like shock, confusion, fear. Second stage is anger. This can be increases in frustration, irritability, anxiety. Third stage is depression. This can feel overwhelming. You might be isolating from others, overall feelings of sadness. The fourth is bargaining. You might struggle to find meaning in the stage or ask, why me? And the fifth stage is acceptance. At this point, you might explore options to move forward and start working on a new plan. And this is not a step-by-step process. And that picture on the bottom right, on the right side, where all of those zags are zigzag all crossed over, that's a more accurate depiction of what it's like to experience grief. It's a complicated process, and it does not follow a specific order, and you will likely bounce around in between all these different stages. I held a support group last week, and one of my patients who had a transplant some time ago mentioned that they recently had a tooth pulled, and this loss of losing a tooth brought back feelings of grief and loss related to their heart failure and eventual transplant, although they were previously in a space of acceptance. This patient was able to process those feelings and move back to a place of positivity and acceptance, but I think this example highlights we can move through these stages of grief, end up at acceptance, and then again find ourselves somewhere in the middle. And if you find yourself somewhere in these stages, be patient and kind with yourself and allow yourself to feel what you're feeling. Next slide. So what do you do with all that? It's important to stay attuned to your emotions as it is physical health. Evaluate your thoughts and check in. How are you feeling or what are you thinking? And it can be hard to label emotions at first. So instead you can say this is what I'm thinking, even if I don't know exactly what I'm feeling. Asking ourselves these questions will work best if we can learn to ask them when our emotions aren't so intense. Then we can apply them at times that are more challenging. Not giving yourself the space and time to process your emotions is similar to having an empty soda bottle that you keep filling with emotions you aren't allowing yourself to process. Eventually, that soda bottle is going to fill up and erupt. But habitually getting in touch with your emotions rather than burying them or willing them to go away can increase your awareness about your own emotions or feelings and improve your overall well-being. Follow your support system. My patients have often said to me, I don't want to burden them. I don't want to burden my loved ones. You aren't a burden and your loved ones want to support you, but they can't do that if they don't know what's going on. And I've often had patients tell me after talking with their loved ones that they were upset they didn't know earlier. And I can't stress this enough. Patients who involve their support system are more successful in managing and navigating their healthcare. Patients can also join a support group and connect with others. I tell my patients all the time, there's something special about connecting with others who are also navigating heart failure and may have experienced similar challenges. Of course, the medical team is here to support you, but there's a different level of support with talking with others who've dealt with similar health problems, and you might find out different ways about how they've coped with it. And patients can ask their provider or social workers about local support groups. Self-care means taking care of yourself so you can manage your health and improve your overall emotional health. This can be something like keeping a regular sleep schedule, taking a shower or bath, eating regular meals, staying hydrated, and exercising in a way that's medically safe. And sometimes I hear patients say it feels selfish to prioritize their own needs above others. You can't support others if your own needs aren't being met. Get outside. Studies have shown the positive impact being outside has on our well-being. Even being outside in the typical weather here in Portland. Find the beauty in the simple things, even the gray skies and rain, and occasional ice. It's important to have activities that bring you joy and fill your cup. I had a patient who was in the hospital for a while, and his wife was always at his bedside. And she was trying to find new hobbies she could do while sitting. She brought in these little starter kits for crocheting. She would often laugh at herself when I stopped by because it didn't turn out exactly how she wanted it to. But she enjoyed it and it became a source of stress relief for her. Moral of the story is to try different hobbies. You might not know you enjoy something until you try it. Next slide. As singer Faith Hill sings, just breathe. Using breathing to keep the body calm is a way to avoid stress building up. The great thing about breathing exercises is that it can be done anywhere, anytime. If you find yourself feeling overwhelmed or feeling your anxiety is increasing, set aside part of your attention and observe how your breathing changes when you are tense. Maybe you're going to a cardiology appointment and that makes you nervous. What's your breathing doing? Is it increasing? You may surprise you to find that you've not been filling your lungs or that you've been holding your breath when you inhale. I want to give an example. There's something called box breathing. You start with breathing into the count of 4 slowly, hold for 4, exhale for 4, hold again for 4, then repeat. And it is absolutely okay if you cannot hold your breath or count to 4 seconds. Maybe start with 2 or 3. Point of doing this is to focus on your breathing and allowing your breath to return to its normal rhythm. Another example that you can try is simply feeling your breathing. Rest your hand on your abdomen between your ribs. This will help you feel if you're breathing deep enough, and the other over your heart to feel your chest rising and falling with each breath. Both of these options can help reduce tense energy and may allow you to re-enter a situation with less tension and more energy or capacity to cope. And this takes practice. There's some really great apps out there if you're good with technology. A good one is Calm or Headspace. Another practice is mindfulness. Mindfulness is a state of awareness that can be created with practice and is a way of being fully present in the moment you're living in. And it can ultimately help people avoid destructive or automatic responses by learning to observe. It can also help diminish the physical impact of stress. By allowing you to be more focused, you are able to see the solution to problems and more able to remain calm in the face of stressors. One example of this is shifting awareness. So when physical sensations are troubling, maybe butterflies in your stomach, sweaty palms, or maybe getting the chills, or maybe you're just in general noticing your anxiety is increasing. Focus away from those sensations. And you can do this by practicing breathing, just noticing the coolness and warmth of the air you're breathing in and out. And do this for a couple of breaths. Then start to bring your attention to the world around you. What are you smelling and what are the sounds you're hearing? And do this for several breaths. Then go back to focusing on breathing. And again, bring your attention back to the world around you. Do this until those physical sensations have reduced and your breathing has slowed. And this can be done in any setting without obviousness, and it can help you recenter your mind by simply directing your attention to the present moment. There's a great website, UCLA Mindfulness, has several exercises there. You can also focus on what you can control. You can control how you take care of your body, how you spend your free time, what you wear or eat. And again, with any of these techniques, the confidence of having a plan to manage increases or stress and anxiety can help reduce the likelihood that you're going to feel anxious or overwhelmed. And finally, seek support when you need it. And how do you know you might need extra support? If you're frequently feeling overwhelmed, feeling fatigued by your emotions, frequently feeling anxious or having difficulty controlling anxious thoughts, feeling persistently hopeless, withdrawing from your loved ones, if your mental health is causing your quality of life to decrease, or has started to impact your school, work, or relationships, or simply you just want additional support. Ask your provider if they have a social worker they can refer you to for extra assistance. Patients can also call their insurance and get a list of therapists that are in network. And finding a good therapist can take some time. This may sound a little ridiculous before I say it, but therapy is kind of like dating. You have to find someone you connect with and feel comfortable with, otherwise it's not going to be effective. And different therapists have different styles of doing therapy. So give feedback during your sessions. Let them know what is and what isn't working. Next slide. So preparing to manage these new health needs. Ask your questions and share your concerns. Your providers want to be able to answer questions you have. You aren't expected to know everything about your condition, but learning more about your condition can be very empowering. Bring someone with you to your appointments. If you have a loved one that's able to come with you, bring them. They can ask questions and help you remember important information from your appointment. And if you're good with technology, take notes on your phone, or just bring a piece of paper and a pen to take notes. And give yourself extra time before appointments. Do you know where to park for your appointments? Or do you have transportation arranged? Do you know who you are seeing, where the appointment is? Do you need to get labs before or after your appointment? Bring a list of medications with you, especially if you're getting medications from different pharmacies. And if you're working, talk to your employer. What does your time off look like? Do you have sick time or paid time off? And how much notice do they need when you have a medical appointment? And if you are working, you may have access to paid leave Oregon. It just started this past September, and you could get up to 3 months paid leave from work if you need to take time off for a serious health condition. And if you need help and your loved ones are working, they also might be able to access this. Next slide. I've mentioned this a couple of times, but be patient and kind with yourself. Be mindful of how you speak. We frequently have thoughts running through our minds. What's your voice saying? Are you your own worst critic or your best cheerleader? Stay connected to your medical team and use their patient portal. If you're handy with technology, does your hospital system use MyChart, or is there another patient portal they use? And if technology isn't your area of expertise, ask for handouts at appointments. And always staying connected to your medical team is going to help ease anxiety and stress and better allow you to manage your medical needs. You are able to develop new ways to decrease your stress and manage new medical needs, and seek the extra support when you need it. And talk to your family about medical decisions and complete an advance directive. An advance directive is a legal document that provides instructions for medical care if you're not able to communicate. It is important to start talking about to your family about what you want your medical care to include. These are not always easy conversations to start, but they're such important ones to have. And this is an easier and a less stressful conversation to have prior to a health crisis or having this conversation in a hospital setting. And an advance directive really just safeguards your wishes should you be unable to make decisions. And I really can't emphasize enough how important it is to have this completed. And if you do complete it, make sure every hospital system you receive care at has a copy. And I want to end by saying our patients are also resilient. Honestly, one of my favorite parts of my jobs is seeing patients overcome some of the hardest situations they face and succeed in doing so. It's really so inspiring. Thank you all, and I hope this information was helpful to those of you who are joining us today. Back to you, Anthony.
Thanks, Caitlin. Thanks for that informative presentation. I really appreciated learning more about the coping tools that we can use to support our patients. And I especially loved how you connected the dots between coping of patients and their loved ones. So thank you for that. Thank you for that. Now, folks, I'd like to move on to introduce Seiko Izumi, PhD, RN, and Associate Professor at OHSU School of Nursing. Dr. Izumi's research interests include palliative care, value-based models of care, interprofessional collaboration, implementation science, and nursing and professional ethics. Welcome, Dr. Izumi.
Thank you very much for the introduction, Anthony. And I'm very excited to be here today. For the next few minutes, I would like to talk about how to use advanced care planning to assist patients and their families to make care decisions through the journey of the heart failure. Next slide, please. So as many of you probably know, heart failure is a chronic condition and it does not happen overnight. Heart failure cannot be cured, but you can manage the condition pretty well. Diagnosis of heart failure does not mean that you failed. And with your heart condition, you just need to take care of your heart. So living with the chronic heart condition is that the journey you need to walk with your heart. Next slide, please. So this is what the typical journey with heart failure may look like. With heart failure, your function may decline slowly. And occasionally you experience the worsening of symptoms such as difficulty of breathing, and you may need to be in the hospital or even in ICU to manage the conditions or receive the specific treatment. You may repeat the hospitalization as your condition worsens. The challenge of living with heart failure is that you cannot predict which one of these steps result in end of life versus you can recover from that. Next slide, please. So along this long journey or the trajectory of heart failure, you need to make many decisions, small and big. So when you have some symptoms before or even after diagnosis, you may have to make decisions such as, should I go to see the doctor now? Should I call my primary care providers or the cardiologist, or should I go to ED? Should I call an ambulance, or should I drive to see the doctor? Another decision you may be that my provider told me about the treatment choices. Which one is the right treatment for me? Or do I really want to go through the process of a heart transplant or LVAD? When you get sicker, you may ask yourself that, do I really want to be in the ICU again? Or then should I be on DNR and decide to stay home and comfortable instead of calling to the ambulance and go to the ICU? So there are many decisions patients and family caregiver needs to make. Next slide, please. So the North Star to support patients and their patients to make their own those decisions is that idea of patient-centered care. So healthcare professionals cannot make those decisions for patients solely based on the medical conditions. To be patient-centered care, patients, their families, and the healthcare care providers working all together as a team make those shared decisions that respecting what matters most to the patient. Next slide. So advanced care planning is a process to prepare and support patients and their families for future decision-making. By assisting patients to understand and share their values, goals, and preferences with their family and healthcare professionals, their families and the healthcare professional can make the decision that align with patients' goals and values on behalf of a patient when they are not able to make their own decisions. The key here is that knowing patients' goals and values is the most helpful information when supporting patients to make the right decisions or making right decisions on behalf of the patient. Next slide. So we cannot predict the future. We cannot predict what type of medical decision you need to make. And you may write down or then let your family members know that what specific treatment you want to or you do not want to receive. But your preferred treatment may not be on the options offered options offered by the providers depending on the conditions. But if you and your family knows your values and what matters to you, then they can apply that knowledge to think through which treatment options offered is most aligned with what matters to you. Next slide, please. So to help the patients, I apologize, this slide is a little bit busy, but to help patients and their family to prepare for the future decision-making, advanced care planning including the 4 different activities. So I start from the top of this triangle. So the first one is naming surrogate decision makers who can make a decision for you when you are not able to make the decision. That is the activity we recommend to everyone, including the healthy person, because you never know that you may be hit by a car tomorrow. The second activity is that completing the advanced care directives. We encourage people to complete the advanced directives. That is a legal document to express what types of treatment you want to receive when you are at the end of life. But most important activity in advanced care planning is that yellow part of that triangle, to have the conversation about your goals and values with your surrogate decision makers and healthcare providers. It is important to have that conversation even when you are healthy but it becomes more important when you have some kind of illness. If you are seriously ill and you may need to make you need to make the end of life decision anytime soon, then talking with your providers and writing down the treatment you want to receive in the form of the medical order using post form may be helpful. All these 4 activities can help the patient and their families to be prepared to make the decision coming up on the future when time comes. Next slide. So the model I just showed you about advanced care planning in the prior slide may seem to be a little bit complex and a bit overwhelming. So here's the 2 key questions that will keep your decision making, that will help your decision making. And I want all of you to take away from this talk today, thinking about for yourself as well as ask to your patients. So question 1. Who would make healthcare decisions for you? I'm sorry, for me, myself, when I cannot make those decisions? Second key question, what matters to me and what is most important things for me? And who needs to know about it? So I will go into a little bit more detail on those 2 questions. Next slide, please. So the first question, who would make decision for me when I cannot? About 2/3 of patients who need to make a decision related to their serious illness do not have decision-making capacities due to their conditions. And making decisions when you are in crisis is very, very difficult. You want someone who can speak on your behalf. So my mother was diagnosed with heart failure many years ago. Lately, she had some episode of pain, GI symptoms, and weakness, and my sister took her to the ED a few times. My mother was conscious, but she was too weak to talk or make any decisions at the time. So I was so glad that my sister was there to make the decision for her and spoke for her. So if you are not capable of making decisions, healthcare providers will reach out to those people on the slide in this order to make the decision for you. So take a look at the slide. And if the person you want to make a decision for you is not on the list, it is a great idea to formally naming the person as your surrogate decision maker in the advanced directives and let everyone around you know who would make decision for you if you are not able to. Next slide. And who would be the good surrogate decision makers? Good surrogate decision maker is someone who you can trust to speak for you, who you can talk about and know your goals and values, who is willing to accepting that role, and who is able to make decisions in the stressful situations. So those are things you need to think about when you are naming the surrogate decision, who's going to make a decision for you. Next slide. Oh, thank you. So advanced directives and post are forms where you can express your preference of treatment as a legal document or the medical order. If you are clear what you want in end-of-life situation, filling those documents and make them available in case of your health crisis could be very helpful. Next slide. But most important and most useful things you can do to prepare for the future decision making is to have conversation about your goals and values and let people around you know about what matters to you. Why? Because those information will guide you and your surrogate decision makers to decide what treatment would best align with your values. I train healthcare providers to have this type of conversation with their patients. And the quote in the slide is what one of our trainees said, how knowing patient goals and values helped her to make patient-centered treatments recommendation to the patients. She said that the advanced care planning conversation training and learning to ask what matters to you helped me refine the quality of life piece. Hearing the patients to say, I want to be to watching the football game on Sunday without pain and stay awake the whole time, that is good enough for me. Instead of, I do not want to be in the ICU. That makes the quality of life piece much more concrete actions. Knowing the specifics of what quality of life look like for this patient, it empowered me to make recommendation what medical treatment would support what he wants. And she was able to make the shared decision making with this patient, choosing the right treatment option that aligned with and support the quality of life for this patient. Next slide. So in summary, asking what matters to you is the most helpful question in decision making. The answer to this question will guide the person, the surrogate decision makers, and the healthcare professionals to make the right decision that aligned with the values of the person and making delivery of the patient-centered care possible. So here's some, next slide, please. So here's some references I used. Thank you very much for listening, and I get back to you, Anthony.
Thanks so much for talking about the importance of advanced care planning with us, Dr. Azumi. I really think your slides breaking down that seemingly complex process into manageable steps is going to resonate. I know it resonated with me, but those of us who are logged in, it'll resonate for us as we help our patients navigate that important step in their journey. So next, I'd like to introduce Jane Mitchell, who is going to moderate our panel discussion and Q&A. Jane is a nurse practitioner and instructor of medicine in the Division of Cardiovascular Medicine at OHSU. She specializes in the care of heart failure patients, specifically transitional care and patient outcomes. Welcome, Jane.
Thank you so much. Thank you, Anthony, American Heart Association, and our speakers, Caitlin and Dr. Azumi. Wonderful presentation. And it's great to see some of you in the chat section that I know very well. Thank you for joining us. I'm going to introduce our panelists. And first, we've got Stephanie Flores-Day. She's a cardiac nurse since 2016. She started her career at Stanford Hospital and joined OHSU in 2018. Jordan Burks is a medical assistant who started with the Knight Cardiovascular Institute in 2023 after graduating from University of Oregon with an undergraduate degree in human physiology. He plans to become a physician associate with a specialty in cardiovascular medicine, hopefully heart failure. Michelle Roberts is our registered nurse. She's been a registered nurse since 2005, specializing in care of the cardiac patient population. She's experienced working with patients in the cardiovascular unit, the ICU, cardiac rehab, and currently she's one of our 3 heart failure nurses at OHSU. Phil Bison is a 63-year-old business owner who is known for his dedication to both family and leisure pursuits. I'm guessing fishing, Phil. Phil was given his heart failure diagnosis in 2022 after he received a double transplant, heart and kidney. He's here today to share his perspective about how he's living and thriving. We have some prepared questions for our panelists, and I know that we've had a couple also added in. If you guys have any questions that you'd like, please just put them in the chat box and we will get to them. So the first question actually I have is for Caitlin. You spoke about how to cope with heart failure, and it's very, very helpful, especially the breathing part. And one of the suggestions that you make is talking to a counselor. And it's very confusing if you look at how do you pick a counselor? What does it mean? What types of therapy? Could you just speak a little bit about what the best choices might be for a heart failure patient looking for a counselor?
Yeah, absolutely. So patients will likely want to find someone who's fully licensed, and different specialties have different credentials. So in Oregon, for a social worker, they will want someone with their clinical license. In Oregon, it's called an LCSW, or a licensed clinical social worker. For a psychologist, you want someone who has their LPC, or licensed professional counselor license, or is a licensed clinical psychologist. It can also be helpful to have a list of questions to ask a therapist before moving forward. So what is their area of expertise? How long have they been working in the field? Do they have any experience working with someone with concerns similar to the ones that the patient is bringing? And is their therapy offered in person or is it online?
Okay, great. Thank you. Stephanie, can you speak about how the bedside nurses support our heart failure patients?
Hi, Jane. Yeah, thank you for that great question. When I first meet my patient as a bedside nurse, I try to understand what they know about their diagnosis and if it's something new or if it's something chronic for them. I then try to understand what kind of resources and stability they have in their lives, such as do they have stable housing, where do they live, and what location that's at. Do they have any significant others that can support them, and what other community resources and support systems do they have? All of this can be very overwhelming and all-encompassing. So I just try to reinforce that we can manage these symptoms and we can manage their diagnosis to the best of our abilities by focusing on the positives. So we start with very basic education. What brought you into the hospital? What was that exacerbated state feel like? Sometimes patients are still feeling it at that moment. We write down and discuss those symptoms in detail. I also provide them with a Caring for Your Heart packet so that they can have something that they can reference back to, and it's not something that they have to memorize or all that information has to be memorized at that point. We talk about managing these symptoms and when to notify your provider. I make sure that they have their provider's contact information written down and recommend it somewhere easily accessible. I put it in their packet with them, and we discuss specifically when do you need to call your provider and what information do they need. When is it okay to go to the provider, and when is it okay and necessary to go to the emergency room? Finally, we talk about a lot of things organically during their hospitalization, like the medication they're taking and why is it important, side effects that are associated with each type of medication and what they might be feeling. And then additionally, we do things like daily weights and fluid tracking and dietary changes throughout their hospitalization. So those conversations do come up, but sometimes it is overwhelming to discuss it all at once. So I get in my provider team, my dietitians, the providers, everyone that's involved, social work, and we all work together to provide the necessary information to their questions that they have when needed.
That's excellent. Thank you so much. Michelle, just finding out for our patients that have heart failure diagnosis, just finding out about the diagnosis can be completely overwhelming. And while we know they're prepared when they leave our hospital, what are your words of advice for our patients who have heart failure?
Thank you, Jane, for that question. When a patient is first diagnosed with a chronic heart condition like heart failure, it can feel very overwhelming. At first, you are likely recovering from a recent hospitalization and just trying to wrap your mind around what this will mean for your present and your future situation. As you recover and connect with your heart failure team, typically you will be started on new medications, be counseled on changing the foods you eat, starting an exercise program, and instructed to track your weight, blood pressure, and symptoms of heart failure as we've discussed earlier. These are common recommendations that are helpful in managing this diagnosis. However, most people are unsure of where to start. There are many resources for our patients and their families to help them answer the question, what do I change and how? Number one, I very much recommend enlisting the help of your heart failure team, your providers, your nurses, social workers, and medical assistants. We are all here to make sure you succeed. Number two, One of the resources that I highly recommend is cardiac rehab. Cardiac rehab is an exercise and lifestyle modification program geared towards helping patients better understand their heart health, while also identifying actionable steps that they can take in improving their eating habits, reducing stress, or starting an exercise program. Participants in cardiac rehab will be given access to a personalized exercise program. They'll build strength and endurance through exercising consistently and gain confidence in managing their heart health. Most insurance plans will cover up to 36 education and exercise sessions based on medical necessity if you have a qualifying diagnosis. There are other wonderful cardiac rehab programs out there in case OHSU is not easily accessible, and I would recommend reaching out to your healthcare team for a referral. Don't let location be the barrier. We also have resources added to the chat for you and your families. You can find additional resources that cover nutrition classes, cardiac support groups, mindfulness stress reduction classes, as well as many educational videos on the OHSU website. Thank you, Jane.
That's awesome. Thank you so much. Jordan, how would you best prepare for your appointment to make it the most successful? What tips can you give to our heart failure patients before they come to their appointments?
Thank you, Jane. Great question. As the patient, successful preparation for appointments should include asking yourself questions like, have I had any changes, positive or negative, in symptoms since the last visit? These changes could include things like rapid weight gain, newfound shortness of breath, swelling, edema, or edema in the ankles, heart palpitations that you notice, low or high blood pressure readings, and or a heart rate or heartbeat that does not feel normal for you. As we've mentioned before, you should write these changes down or commit them to memory and really make it a point of discussion with your provider at your next appointment. Additionally, I would think about some other questions such as, were there medication changes made at your last visit? And if so, how have you felt after those changes? Positive changes where you're feeling much better should be reported as well. Another question to think about would be, were there instructions to track your weight, blood pressure, and heart rates? And have you been able to keep a log of that data on a daily basis? Generally, you should follow the instructions from your provider on the after-visit summary from your last appointment and bring all of your medication bottles into your appointment, or verify that you have a list that exactly reflects how you've been taking all of your medications. This will allow you and your provider to review and update your medications as is needed. Following all of these recommendations should set you up for a successful visit and will help your provider make the best possible medical decisions for you. You can always call or send an electronic MyChart message to your provider's office to report changes in your symptoms and get advice when you don't have an appointment as well. Thanks for the question.
Thank you so much. Now, last but not least is Phil Bison. And Phil, I'm so grateful to have you here today with us. You're the reason that we're here. And I would like for you, I'm hoping you can speak a little bit about your experience, what you can pass along to other heart failure patients about how they can succeed with their heart failure.
Well, thank you very much. It's great to be here. The biggest thing I think is when you're first told that you have this problem is not to reach out to too many people right away. Kind of, you need at least a day or two to take it in and talk with, for me, is my wife Paige, which was a rock on this, and discuss what we're going to do going forward with the kids and the family members. And because you've got a journey ahead of you and you're trying to figure the best way to get through it. And for me, it was kind of passing off all the things we were doing to my wife and her talking with the kids and my family members and just allowing me to concentrate on listening to the doctors, the nurses, and communicating with them It's just so important. And going forward, meeting with the doctors and nurses is to have somebody there, which was my wife Paige, which was great, to write things down. Because a lot of the times what I was hearing from the doctor was different than what she was hearing from the doctor. And so when we got out of that and we started talking to each other, it was just much better to communicate back with the doctors and the nurses on it. And the biggest thing was when I went up to OSSU, is the doctors and nurses. It's kind of like getting aboard like maybe a train or something. And everybody working, the communication with everybody was just unbelievable. And what that gave you is hope. And that was just made your optimism and everything so much better. So it's just it's a long journey, but you gotta right away, you just gotta kind of gather your emotions. Then after that, get on support with your family if you have them, or friends or whatever. But it makes it a better experience because there's light at the end of the tunnel, and that's what you're looking for. That's basically just hope. So that's what I did.
I appreciate that. That's amazing.
Yeah.
And bringing somebody to your appointment, you're right, is key, because I think that sometimes our patients hear the first sentence that you say, you have heart failure, and then the rest of it is like, what? I have heart failure? I mean, it's a terrible way to say it. I wish we had better verbiage.
Yeah, it was an eye-awakening, that's for sure.
Thank you for sharing your experience. I'm going to ask a couple of questions that are in the chat group. The first one is, how do you help a patient build resilience when facing a heart failure diagnosis? Can any of our panelists answer that?
Yeah, I can answer that. I think meeting them where they're at, being understanding and compassionate about what they're feeling and what they're going through. And I think, as Phil mentioned, involving their support system. It could be a spouse, it could be friends, it could be community members, whoever is a part of their inner circle, and involving them in their care. And I think finding their strengths. Every single patient has strengths out there. So identifying what those are and verbalizing those to patients. Patients don't always hear or see their own strengths. I think identifying those and celebrating those with patients.
Excellent. Thank you. There's a comment, I think, from Amy and Bend, and she just talks about, she's a heart failure navigator, and she says, I talk to my patients about new hobbies or figuring out new careers if they're in really physical demanding jobs. So what do you do with that patient who has a very physically demanding job that now, many times they're unable to continue with that? Would anybody like to talk about that of our panelists?
I can take that one. Yeah.
Yeah, I was gonna say it might be you again. Yeah.
Yeah. So I think first having them talk with their employer if they need to access the paid leave Oregon or FMLA, that they can do that. So they're likely going to need time off work. Getting them connected with the social worker, because they're likely going to have to apply for disability. And so guidance with doing that, because it is a lengthy process and it can be really overwhelming to dive into that. And I think the other part is there's some community resources like vocational rehab that help patients that have health conditions get back into the workforce, regardless what that looks like for them. But they'll meet the patients where they're at and help them evaluate what they can do moving forward. But I think definitely involving the social worker so they can help them explore what resources are available to that patient.
That's a great idea. I often do recommend to people that they take time off. Many times patients will say, I've got, I can take some time off. And I'm like, do yourself a favor and take off the next month or two, just so you can start with cardiac rehab and you can start taking care of yourself and sort of refocusing. It looks like there's another question, and that is regarding community resources and patients discharging from the hospital as far as utilizing home health to get another set of eyes to help the patient, et cetera. Michelle, do you want to talk about home health?
Sure. Thank you. Home health is a very vital resource for some of our patients out there that may need some extra help with navigating their medications. Maybe this is new for them, starting medications that are really important to be taken at certain times of day. Maybe they need to learn how to track their weight or take their blood pressures. So home health, a nurse can come to your house and take your vital signs, do an assessment, help you with putting the pills in your pill boxes so that you can keep track of that and communicate those visits to your providers. If you feel like you are needing additional support to navigate your health at home, ask your healthcare team if home health would be an option for you. I think it's a very helpful resource.
Excellent. Thank you so much. Dr. Azumi, I have a question about advanced directives. Where do you find advanced directives? Where do our patients go to access this?
Thank you, Jane. And that is a great question. So if you are living in Oregon, state of Oregon, there is the Oregon State Department for Health has providing the latest the advanced directive forms. So just Google search the advanced directive, the Oregon State, then you will find the the latest most updated the form for the Oregon State advanced directives. If you are the patient, but if you are part of the OHSU, then there is some other OHSU specific materials, including the advanced directives for the state. So asking the providers that can I have the copy of this? Then you will be able to get it much easier. There are also several other websites which maybe make it available for the not Oregon State Advanced Directive, but some similar materials which start to being used in the state of Oregon as well. So just ask around, the majority of the providers, clinicians, or the front desk person often knows where those exist or where in the shelves they keep those things. So, just asking those people would be the best way to move forward.
Great, thank you.
I can add to that too. Prepareforyourcare.org is an excellent website that patients can go to. It has a ton of resources on there that are all free for patients. And it talks a lot about having those discussions with family members. So wanted to share that resource too.
And it's
prepareforyourcare.org.
Great. We'll put that in the chat box as well. Thank you so much. Other comments?
Can I add one more things to the the Caitlin's response? So the prepareforyourcare.org, I put it in the chat. That is great resources, and they have providing the easy to read advanced directive form for the different state, and it has the Oregon State forms. And the last time I heard was that the OHSU tried to approve that that form is appropriate to use in OHSU. It may not be formally accepted as a legal document in the state of Oregon yet, but it may be coming, and it is pretty compatible. So if you think that advanced directive form in Oregon is too complicated, then I really encourage you to go to take a look at the prepareforyourcare.org, easy to read advanced directives for Oregon State.
Oh, great. Thank you so much. So I think I've heard you say before, Dr. Azumi, this is a kitchen table discussion, not an ICU discussion. Excellent. Okay, well, I believe that's I'm gonna return us back to Meredith for some closing remarks. Panelists, I can't thank you all enough. Phil, I'm forever indebted that you shared your time with us. It's been amazing. You're amazing. You're all amazing. And we really do appreciate, your time and everything you've done for this webinar. Thank you. Meredith?
Guys, thank you, Jane. And special thank you to all our presenters for wonderful information they shared with us today. We hope this presentation has provided you with helpful information on heart failure management, and thank you all for taking the time out of your busy schedule to join us. We'll be sending a link to the recording and to all registered attendees. So on behalf of the American Heart Association and OHSU, we'd like to thank you for attending today and hope you all have a great day.